Generalized anxiety disorder, or GAD, is a chronic disturbance characterized by excessive worry and apprehension accompanied by psychic and somatic symptoms of stress and anxiety. As you see on the picture on the right, there is a kid who is worried about 5 things. It looks like he is worried about a dog maybe attacking him, a storm coming, a meteor hitting the earth, a robber, or even failing his own test. A century ago, Freud noted that chronic free-floating anxiety occurred frequently in the general population, and yet, to this day, there is limited information available about the natural history of this disorder. Its resemblance to normal anxiety and the lack of distinctive distinguishing features have led to poor diagnostic reliability and other questions about the validity of the disorder. The relative mildness of the symptoms and the high rate of comorbidity with other psychiatric disorders, the highest of all the anxiety disorders, have caused some to view it as an associated feature of a number of other disorders, rather than an independent disturbance. Nevertheless, no matter where the diagnostic threshold is set, GAD is common, and it is the least studied of the anxiety disorders. A major change in the nosology of anxiety disorders occurred in 1980 when changes in classifications adopted by the American Psychiatric Association, or APA, separated anxiety neurosis into one panic disorder, characterized by spontaneous episodes of intense anxiety, and GAD, a residual category for patients who have chronic, sustained anxiety without panic attacks. The distinction between these two disorders was defined at the time by the observation of a differential response to medication. Klein noted that the panic disorder responded to empiremine, while GAD responded best to benzodiazepines, or benzos, although it has been demonstrated more recently that patients with GAD can also respond to the empiremine better than the benzos, if taken for a sufficient length of time. In DSM-2/3, hierarchical rules prohibited the diagnosis of GAD if any other psychiatric disorder was comorbid with the chronic anxiety symptoms. In DSM-3/R, GAD was given independent status with clearly defined symptoms criteria. The trait of excessive worry was identified as the core symptom of GAD. With the revised classification, most hierarchical rules were eliminated, making it possible for patients to meet criteria for GAD and other anxiety or depressive disorders simultaneously. In contrast to the DSM-3/R, DSM-4 eliminated from the criteria the autonomic symptoms of anxiety. Although these symptoms are common in GAD, they had led to diagnostic confusion with panic attacks. The 6 remaining symptoms are characteristic of prolonged excessive arousal. Over time, the criteria for GAD has been more systematically studied. In the DSM-4, the symptoms checklist have been consolidated to reflect symptoms that best discriminate between the normal and pathologic anxiety. In the United States, there are 6.8 million American adults who have GAD, and women are twice as likely as men to develop GAD in their lifetimes. GAD develops slowly over time and can begin at any point in your life, but it is most likely to affect people between childhood and middle ages. While women have been noted to be twice as likely to develop GAD, it is not clear if women are at higher risk of developing it, or simply are more likely than men to seek out treatment and appropriate diagnosis. Some research has also found that GAD may affect people at different rates based on their age. One study summarized through prevalence estimates that reported that although research on GAD in the elderly is not complete, 17% of elderly men and 21.5% of elderly women experience severe anxiety. Furthermore, the rate of GAD in this population may be the highest of any age group. They also reported that the lowest prevalence rates are for the people between the ages of 15 and 24. If you have GAD, you may experience persistent worry and discomfort that could last for months. Your level of anxiety is out of proportion to the situations at hand. It is excessive and out of control, inhibiting your daily life. This may affect your ability to function at home, work, or even school. Some common symptoms can include you feeling restless, you having a difficult time concentrating, trouble sleeping, avoiding anxiety-inducing situations, or constantly needing reassurance. Here are some more symptoms of GAD. Continuous cycle of headaches, irritation, pain in the muscles, your legs and hands are trembling, you get frightened very fast, again, you're having trouble with sleeping, copious amount of sweating, and too much tiredness. GED is very common and can be managed through therapy and/or medication. It is often recommended that you visit your primary care doctor to make sure there isn't another health issue at play. Your doctor may run some tests like blood work to make sure everything is okay. If other medical issues are ruled out, they may refer you to a therapist specializing in anxiety disorders. A therapist or psychiatric will diagnose you based on your symptoms and how long you have been experiencing anxiety. Based on how much it interferes with your routine, your doctor will recommend a course of therapy such as cognitive behavioral therapy. Whether or not you need medication in addition to therapy sessions is dependent on your unique situation. Medication is not an option for everyone. Talk to your doctor about your specific needs and concerns to see if medication will be a great fit for you. In general, the prognosis of generalized anxiety disorder is good. With appropriate treatment and intervention, most patients make progress in treatment within a few weeks to a few months. Here's a picture that I found on the internet with some treatments of anxiety. The first one is pharmacotherapy, which is basically just like your medication, the antidepressants you can get. The second is behavioral treatments, relaxation training, hypnosis, biofeedback, cognitive therapies. And the third one, lifestyle interventions. If you exercise daily, it can treat your anxiety, and some people like to smoke, and that can help them treat their anxiety as well. Treating anxiety disorders with medication is a practice that has a long history. Yet nowadays, these type of treatments have become very controversial because of the numerous side effects which anti-anxiety and antidepressant drugs may have. Another reason which has limited the prescription of these drugs is the fact that tolerance to them can be easily developed. In spite of this reluctance to antidepressants, they can be useful if taken according to the doctor's prescription. They are usually prescribed for the most anxiety disorders, like panic attacks, phobias, post-traumatic stress disorder, obsessive-compulsive disorders, and generalized anxiety are the conditions which can be treated with anti-anxiety and antidepressant drugs. However, it is necessary to note that they are not used for curing this condition, but rather that evaluate some of the symptoms they may have. The main types of anti-anxiety medication. The best known type of anti-anxiety medication, and probably the most used one, is the one with benzodiazepines. The benzos are commonly known under the name of tranquilizers because they prevent the nerve impulses to reach the central nervous system at the normal speed, which can limit the anxiety symptoms. The class of benzos contain more tranquilizing substances such as alprazolam, which can be found in Xanax, clozapine, a substance which can be in pharmacies under the name Klonopin, diazepam, which can be found in Valium, and lorazepam. The anti-anxiety drugs slow down the nervous impulses. This leads to the calming of the brain and consequently to the reduction of the anxiety symptoms. In addition to this, they may induce a pleasant feeling which may make life more enjoyable for the person who has suffered from the anxiety. The side effects. There are some cases in which the positive results for which the anti-anxiety drugs are prescribed are overstepped by the numerous side effects. People taking this type of drugs may experience dizziness, drowsiness, memory problems, and even confusion. Also, the patients may become addicted to those substances or may experience depressive states. Benzos may even produce a side effects similar to those conditions for which they have been prescribed in the first place. This means that a patient suffering from anxiety can fall deeper in this condition because of the medication that was supposed to cure him. The elder people are more prone to this type of side effect. Because of the side effects and the high risk of interfering with other drugs, anti-anxiety and antidepressants should be taken only under doctor supervision. There have been cases in which people who have took this type of drug have taken additional medication without the doctor's advice and died because of the toxic combination between the two. Also, elderly people and pregnant women are strongly advised not to take antidepressants. The diagnostic validity of GAD has been questioned since its inception in 1980. Although there is limited information about the course and outcome of this disorder, especially in the elderly and in children, the existing data support GAD as an independent diagnosis. GAD is a chronic and disabled disorder that is stable over time and distinguishable over any other anxiety disorder. There are a number of unanswered questions related to this disorder. Future research is needed to delineate the severity of the illness over time, as well as an effective treatment.